To test the posterior cruciate ligament, we have two tests. One is posterior drawer test and one is posterior sag. In the posterior drawer test, patient lies down supine on the couch and the examiner sits on the foot of the patient. Here, while holding the leg with both hands, examiner tries to push it posteriorly. Then, if he feels there is excessive movement of the tibia posteriorly, if there is excessive translation of the tibia posteriorly, it indicates there is a tear in the posterior cruciate ligament. Here is the posterior sag sign. Ask the patient to flex the knee joint to 90 degrees and see it from the sideways. If there is excessive sag of the tibia, that indicates a tear in the posterior cruciate ligament. For testing the medial collateral ligament, we do valgus stress test. That means we hold the thigh with one hand and hold the leg with other hand and try to open up the medial joint line. If there is excessive opening on the medial side, it indicates tear in the medial collateral ligament. To test for the lateral collateral ligament, we do the varus stress. Here, examiner holds the inner side of the thigh with one hand and holds the leg with the other hand and try to open up the lateral joint space. If there is excessive opening on the lateral side, it indicates there is a tear in the lateral collateral ligament. Here is the examination video. Here patients lie down supine on the couch relaxedly and knee is flexed to 90 degrees, hip is flexed to 90 degrees. Examiner tries to pull the tibia. There is excessive movement of the tibia anteriorly. And here is the latchment test. Here also there is excessive movement of the tibia anteriorly. Both these tests indicate tear in the ACL. Here is the pivot shift test where examiner tries to flex the knee joint with knee in internal rotation with valgus stress. There is a sudden slip at the knee joint while flexing that indicates the ACL tear. Here is the posterior drawer test demonstrating tear in the posterior cruciate ligament. Always compare it with the opposite leg. Here is the valgus stress test. There is an opening on the medial aspect of the knee joint indicating that there is complete tear of the medial collateral ligament. You can see complete opening of the medial joint line indicating complete tear of the medial collateral ligament. This is the McMurray test where the thumb is placed on the medial joint line and knee is flexed completely and then extended with the foot in external rotation. And here the thumb is on the lateral joint line and again knee is flexed and extended, looking for the pain in the joint line. If the patient complains of pain while flexing or extending, that indicates the meniscus has some tear in the knee joint. These tests are called McMurray tests and these are useful for identifying the tears of the meniscus. Thank you.